came in through the bathroom window. No, that was a fetal zone. This is the caudal vena cava. We cut through here, cut through the right atrium. We did not cut through the cranial vena cava. This is the cranial vena cava right here. Okay. But if we pull this back, if you look right here, you can see a depression that's about the size of the end of my finger. Somebody ripped it because they got a little bit overly crazy, but that is the fossa ovalis. Now we're going to talk about that in class. In 6B, we'll talk about it. It's a fetal bypass. That actually was a hole, foramen ovale. Okay, it was an oval opening, and there was a little flap in there. And what happens is there's more blood coming into the right side than the left side in the fetus, and we'll talk about why. That's not the case for an adult, but for a fetal heart, there is. So because there's more pressure on the right side, it pushes that flap into the left side, and the blood goes right through that opening right into the left atrium. A little bit will go to the left, to the right ventricle, but most of the blood actually goes to the left atrium. And so we'll talk about the consequences of that. It actually turns out to be kind of important, okay? But that would be the fossa ovalis. We have, I think we've got most everything else. Here's a bronchus here, and we can tell because cartilaginous rings. That's always the key.
Bronchus.
And we haven't talked about that, I guess, in class yet. Have we? Did we talk about the cartilage? Okay, but we're going to see the cartilaginous rings are incomplete rings. They're like a C, and there's dense connective tissue across the opening. You can see that even in the bronchial tree. So it, not just in the trachea, but it extends down into the bronchus. Dude, pretty good?
Yeah.
Okay, any question? Okay, so I'm not throwing you out early. You can stay if you wish, up to you.
What's
All
up?
right?